Hello, Kidney Warriors. James here from Dadvice TV, your online kidney health coach. And this is video number 100 in my journey from kidney failure to kidney great. Now, today we're going to talk about something actually kind of painful, gout. And it's something that I've suffered with, especially when I was first diagnosed. But things we're going to talk about today are things that helped me get it under control and stop those flare-ups in the gout attack. Now, if you are new to Dadvice TV, welcome. We are a great, positive, and supportive community. And go ahead, type new in the comments. That way everyone can say hello and know that you're new. And let us know where you're from. Now, if you're new, that means you also don't know who I am. I am James. I'm a kidney patient. I'm not a doctor. I'm just a super nerd. I was diagnosed with stage 5 kidney failure. It was bad. I had no clue what I was doing to my kidneys and my diet as my waist kept getting bigger and bigger, and I was eating more and more fast food and guzzling down Dr. Pepper. But I turned my life around, and I did not go on dialysis. I did not get a transplant. I was one of the lucky ones who was able to use diet and lifestyle changes to turn my life around and go from stage 5 to stage 4 to stage 3. But more importantly, because those stages to me really don't mean much, what is most important to me is I feel great, I have tons of energy, and I do not have a single symptom, not a one. And I practically had all of them in the beginning. Now, the one thing of everything I did that was the most important, the most impactful, the secret to living a great life with kidney disease is working with a renal dietitian. And it's Tuesday, this is Dadvice TV Live, so we've got here with us Jen Hernandez, a renal dietitian. Hey there, Jen, how you doing?
Hey, James, I'm doing so great. Really, really happy to be back on here and very excited to talk about gout with you today.
Yeah, now tell people who are new here a little bit about what the heck is a renal dietitian besides being the most important thing in helping you kick kidney disease to the curb.
So a renal dietitian, which is what I am, is essentially a registered dietitian. So a dietitian goes through their undergrad, going through nutritional sciences, dietetics, now going through a master's program as well. Then you have to go through an internship and you learn in the hospital, in nursing homes, in schools, in communities, all about nutrition and how to take care of people with the food that they want to enjoy. And then you have to take an exam to become a registered dietitian. I took it the next level further when I decided to become a board certified renal dietitian, which meant I had to do another 2,000 hours working only with people with kidney disease and then take yet another exam. So I am now a board certified renal dietitian, and that is what I do for my work. And I really enjoy it. I do it 7 days a week, helping people with kidney disease and their nutrition, taking care of their diet so that they can feel better and sometimes even see improvements from their kidney test results, which is always fantastic to be a part of and experience alongside with them. So that's what I do. I help people with kidney disease.
Yep. And if you guys have not joined Jen's Facebook group, Plant Powered Kidneys, when we're done with this show, take a moment, go find it and join it. Answer a couple questions. We got a few questions there so we can keep the spammers out and those bots that love to just post all sorts of stuff. But there is tons of great information and a great supportive and helpful community there. And Jen does my favorite thing, cooking videos. You have a regular schedule, right? It's like every Thursday, I think.
Yeah, it's this same time on Thursdays. I try to get on there every single week, and I like doing the little cooking videos. Sometimes I'll talk about certain topics or concerns, some questions that come up in the group when they have an issue and it just kind of bubbles into something bigger. So I will try my best to address things like that. But just like this, I really work to make sure I'm there every single week.
Awesome. And if you guys have not subscribed to Dadvice TV, go ahead and click the subscribe button on YouTube. We are approaching 100,000 subscribers, which will mean a lot to me when we hit that mark. We're going to hit it. We're going to hit it before the end of the year. And I can't wait because then YouTube sends me a plaque with a silver play button, which will just be amazing. I will be so excited for having that and putting it up on the wall. My kids have a YouTube channel and we've had it for a long time. We've been working hard to get their subscribers up. So my kids they're gonna think, oh, that's theirs. And I'm gonna let them think that they got it with their channel. But it means a lot to get that. All right, so let's jump right on in to gout. And for kidney patients, even if you don't have gout right now, this is an important conversation to listen to so you can prevent or at least greatly reduce the chance of having to suffer from a gout attack. And that's exactly what they're called, a gout attack. And they are not fun. So let's start with the beginning, Jen. What the heck is gout?
So gout is a type of arthritis and it's very, very inflammatory. It's something that can either be acute or chronic. So in an acute case, it would be one joint that's affected and it happens once, not over a long-term period of time. Chronic, it happens in multiple joints and it happens on more than one occasion. So it's important to know that difference, but essentially think of the joint. Most commonly is the big toe that gets really, really swollen, inflamed, and painful.
Yeah, and I, before COVID, would drive almost every Sunday to Hoffman Estates, about 45 minutes past Chicago. So it's about a, 4.5, 5 hour drive for me. And oh my goodness, when my gout would flare up, it just hurt my feet so much. It made driving so painful. But luckily, I learned, and we're going to talk about it soon, how to manage it. And I haven't had that happen at all. So besides being painful, who has to worry? Who's at risk of gout?
Well, it's kind of interesting, the connection between gout and kidney disease, because fundamentally with gout comes this level of high uric acid. And if we think back to our kidney stones video that we did a few weeks ago, you know, we talked about some of the stones, including uric acid stones. So with gout and kidney disease, there is that connection there of the uric acid. And some people with kidney disease their doctor will check their uric acid levels because of that higher risk. And I've had clients who get put on gout medications even without realizing and never having experienced a gout flare, but they were put on this medication to help prevent that and to help keep their uric acid levels controlled. It is really important to know that just because you have a high uric acid level, it doesn't mean you have gout. So it's just something, again, that is what the doctors will be monitoring for when they're looking at your uric acid. So you can't get an official diagnosis of gout unless you're in a flare. So if you have a flare, if you're in a lot of, obviously you're going to want to go get that checked out. You don't want to let that just subside and say, okay, I'm just going to not think anything of it. You want to go get that checked out. And during that process is where they can do the testing to verify that it's something that is confirmed as gout. And then they can take the steps further going from there.
Yeah. And I'll tell you, once you've had gout once, you definitely want to go to the doctor during the flare up. The first time it happened to me, I just thought I broke a toe or something like that. And I'm like, okay, I'm just going to ice it, not move it. I was at home. I wasn't traveling. And eventually it kind of went away, or it got better. But I talked to my doctor about it and he said, it could be gout. And I thought, okay, do a test. Let's find out. He says, you got to come back when it's happening so we can do a test. It's like a car that has a rattle. They need to hear the rattle to figure it out and know what it is. Yeah. So then I did get tested the next time and found out. And, my first question, of course, was, what are we going to do about this? Let's see, my next question. So the only way to know that I have gout is to go to the doctor. It's an important thing. I know, guys, it's easy for us to want to go on Facebook and message groups, stuff like that, kind of say, hey, here's my symptoms. And someone say, hey, I think it's gout. And then we self-diagnose ourselves, but we really do got to go to the doctor. because it could get really, really bad. I don't want to gross anyone out, but my big toe on my driving foot, my right foot, and I'm a car person. I love to drive. Oh my goodness. I love cars. It looked like I described it to Jen once as a big old red apple. I thought I had like a bee sting or I broke something and it was swollen. It was larger. But if you have a problem like that, make sure, tell your doctor, call, get an appointment, let them know, hey, I think I'm having a gout flare up. Your doctor, even your primary care physician, they'll know, okay, timing is important. Let's get you in now, not next week, so they can do a test and find out. Now,
right.
A lot of people, there's a connection. A lot of people believe there's a connection. How do I say this? What is a connection between gout and chronic kidney disease? Because it's there.
Yeah. So it is kind of, sometimes people can see it as like a chicken or the egg, that old verbiage, which came first. So it can be that gout and kidney disease are interrelated. It's more so being that when you experience gout, it can lead to worsening kidney symptoms. So it can lead to poor kidney function, for example, because the kidneys are responsible for eliminating 70% of the uric acid. So if you're having gout, which is this inflammation from this accumulation of uric acid that is hitting your joints and causing that inflammation, then the kidneys can't get rid of it. It worsens the gout. Then the high uric acid levels worsen the kidney function. So there is this essentially a two-way road of it being more that CKD will cause the gout rather than gout causing CKD. But if you already have kidney disease and you have gout, it can just make matters worse if it's uncontrolled. So hopefully I made that clear, that it's mostly the CKD leading to the gout, not gout leading to CKD, causing CKD. Gout can aggravate CKD, if that makes sense.
Yeah, and I never had a gout flare up ever in my life. As a matter of fact, before I had it, I always thought of it as something my grandparents got, as something that more, the elderly sitting at home, relaxing, retired, enjoying life, that it seemed to be a problem that they had. I like to describe myself as not us youngins, But once I had my kidney disease, it got to me. Now we have a great question here. I want to pop it in real quick. Victor asked, "Is the test for gout the same test as BUN?" I know the answer, but I'll let you answer it.
No. So the BUN is a blood urea nitrogen, which if you want to brush up on your labs and knowing more about your labs, make sure you watch our video that we did talk really in depth about a lot of different kidney related labs. This is a test of uric acid levels in your blood. It's still a blood test, but there's also additional testing that includes X-ray testing to see exactly what's going on in the joint. So that it will look at those crystals inflaming the joint. Primarily a rheumatologist, which is a doctor that specializes in like skeletal muscular diseases, autoimmune conditions, things like that. A rheumatologist will be someone that you might get referred to if you are having these symptoms, aggravated symptoms of gout, that your primary doctor or a nephrologist might say you should go see a rheumatologist to kind of figure this out. Some doctors will take it on themselves and help with managing that, but it's always entirely within your right to ask for a referral to a specialist to get further details about what's going on there. But no, it's not the same as BUN.
Yep. And Linda asked, what does BUN mean? That is blood urea nitrogen. That is one of the kind of the standard tests that you'll get when you get your labs done to check how your kidneys are doing. And Jen and I did a great video, I think about 3 weeks ago, about understanding your labs. Actually, it was the very beginning of last month during Kidney Health Week. We talked about that, understanding your labs. And I'll make sure and add a link to it in the description. Now, speaking of previous videos and uric acid, oh, that rings a bell, kidney stones. And we talked about that. So, what is the relationship to gout and painful kidney stones? We're talking
Well,
about pain today.
I know, yeah. Well, this is definitely something that can be really actionable if you pay attention to the things you can do to prevent it. So I think that could be really helpful.
Hmm.
So with gout, we're talking about the uric acid buildup in the body coming from mainly some of the foods that we eat, and it stays collected, and the kidneys aren't able to get rid of that excessive amount. So the uric acid collects around the joints and causes inflammation there. There's also a risk, depending on your type of kidney stone, if you have uric acid stones, that can lead to more stone development. So it's really important. But let me backtrack for just a
Hmm.
second. Of course, watch the video about kidney stones to get even more details about that. But calcium acid or uric acid stones, there we go, are not the most common stones. So it's much lower of a risk of that happening. But that's where it's important to find out what kind of kidney stones you have to see if there's a relationship there for you with your kidney stones and possibly a risk of gout. So make sure you get that checked and verified that you know what kind of stone you have. If it's uric acid stones, that is another sign that your kidneys aren't able to get rid of that uric acid as much, and it's collecting, condensing into that stone and causing more pain in other areas.
Yep. Now, can I dissolve those stones? Are they the easier ones to get rid of? Because I know some of them are really hard.
Yeah, so they can potentially be dissolved by potassium citrate, and that's a medication that is prescribed by your doctor. So never, I mean, first of all, we've talked all the time about potassium with
Hmm.
kidney disease, and you got to be careful with that. So a medication that has potassium in it, you really don't want to take that on your own accord without a doctor's acknowledgement. So potassium citrate is a type of medicine that can be prescribed to help with getting rid of the stones. If there is a potassium concern, sometimes the doctors will use sodium bicarbonate.
Hmm.
But again, this is something that is entirely overseen by your doctor, whether it's your nephrologist, your urologist who specializes in kidney stones, or your rheumatologist who is working with the uric acid side of things for your gout. Whoever is taking care of that and overseeing it, you want to really follow exactly the directions of that prescription medication by the prescribing doctor. Don't take other supplements. Don't take other things that you think would eliminate them, because you never know how your kidneys, your body are going to react to those added things, especially when you're already on a prescription medication to help eliminate it. So that is something that the doctors could do. If the medication's not working, if it doesn't dissolve the stone, they can do what's called shock wave lithotropy. I think I can say that right.
Ooh, good,
Ba-
good. I don't even try that one.
so this is a type of an intervention that will basically break down the stone inside in a procedure. So there might be other surgeries that are needed, but again, that's all up to what's going on with your body and your health, and your doctor is the one who's going to be able to give you those details.
Yeah. Now we have a number of questions, and I knew we'd get to this point pretty quickly about the things that you can eat that do cause gout, that cause this problem that we should limit or avoid, and then things that are good that may help. And I'm going to start off with someone asked, can gout attacks happen even if you're eating a clean diet? So if I'm eating what I should, not too much of the foods that cause it, could I still get a gout attack? Do you know,
I
are there
mean,
other things that could cause it?
it's possible that it could happen, but I will say that the primary way that we're getting the uric acid, it's from metabolism of purines, and purines are something that are in our diet. So if you are focused on eating a better diet that doesn't have foods that are high in purines, then you're really, really reducing your risk. And we'll go through a few different examples and then talk about some other tips when it comes to other things that you can do to help reduce. Never say never. I don't want to say that this will guaranteed eliminate any risk for you, because that's just not possible.
Yep.
We can never guarantee things when it comes to medical health and medical nutrition concerns.
Mm-hmm. So what are some foods that, well, let me back up. There's a few words I always avoid, and I don't think people realize it, but to think that I've been talking about things for so long and there's certain words I've never said. Purines is one of them. What the heck are those? I've read about it. They're in some foods and some are high, and I'm not supposed to eat those, so I don't. But I have no clue what those are.
Yeah, so purines are a component that comes from our diet in a variety of foods and forms. I'm trying to think of how I can explain it without getting too like not detailed, but like I guess
too complex.
I don't know. Yeah.
Yeah.
I don't want to get it because it's found in the cell of the animals or the plants. I can't get into all the details, but what I will say is that it's not just in animals or just in plants or just in something. It's in all of these different things. So the important thing to know is that depending on the source, we have some evidence and some research that shows that it's a little more harmful in some areas and not as harmful in other areas. This kind of goes back to the idea that I'm a really big believer in, which is a plant-based diet for kidney health. Because there is evidence to say that while there are some vegetables that are higher in purines, so spinach and asparagus would be some examples, evidence is showing that those, and again, like the details of it is kind of still, we're learning about it. Nutrition science is very, very baby science. But we are learning that the plants aren't causing as many problems. They are not seeing an increased risk of gout attacks for people who even eat those plant foods that are high in purines. So that's something to keep in mind, that if you are, if you're eating some foods, animal products, and we'll go into some of the other foods to avoid, but depending on what that is, you can still help reduce it, but keep some of those things like fruits and vegetables in your diet. That can be really helpful to avoid those gout attacks.
Yeah, so I'll tell you, when my doctor gave me a diet to follow once I was diagnosed, and I looked back at it, kind of preparing for this. I was like, what all did he tell me? Let me go look at it all. And it pretty much gets, if you could boil it all down, it was eat plant-based. That's pretty much what he told me. And we're going to talk about some of these things, but it really, that's what he recommended for me. I am always the one, I don't want a pill unless I absolutely have to have it. Is there something I can do? If I run on an elliptical for 20 minutes a day, will that help this? I'll do that. Tell me what I can do to avoid a pill that not only helps us, but makes me healthier. And his response was, he gave me a list of things, and it's everything you talk about on your Facebook group, Plant Powered Kidneys. All of that, you don't talk about it as, hey, this can help prevent gout, but everything you talk about is what helps prevent gout, to a great degree.
Yeah, it's crazy when we kind of take a step back from a lot of these different concerns. And we've talked about it with blood pressure or blood sugars, right? We've had a few episodes we talked about like diabetes. And although it sounds like it's really confusing, and it can be really frustrating when you're thinking about all these different health concerns that you might have. When you really boil it down to the fundamentals and you start comparing these different handouts, I mean, for one, a handout's only going to give you so much information, but you can still see some similarities that they're saying, eat more fruits and vegetables and be careful with meat and be careful with certain drinks and, get exercise and all that kind of stuff. Like, you notice that there's a lot of common recommendations across the board that are helpful.
Yeah. And it's becoming more and more apparent to me as I do have small challenges like gout, and then I don't want a pill. I want, what can I do, if possible, to prevent this or to manage it? And the answer is almost always the same. Okay, we're going to get you more active. We're going to drop red meat. I haven't dropped red meat 100%, but I treat myself like once a month. That's it. But I went from such a bad eater to now eating so much healthier. And overall, not only has my health improved, but my kidney health has improved, which has reduced all the symptoms, gave my energy. It's just amazing how so much of this is in common. So let's jump in. Oh, go ahead.
Well, really quick, I want to ask, when was your last, because you mentioned that gout flare. When was your last gout flare?
Oh, I remember it. I was driving to Hoffman Estates. It probably, I'm going to say, may have been last October or November. I think October. It's probably been a year. It might have been November. So it's coming up to about a year ago.
And how long have you been focusing on eating better?
So, yeah, exactly. So I tried. So my story is I tried to start making better decisions. I kind of put my toe in the water, and I really got serious about it, and things just started to click to where it was easy all of a sudden. It's like, holy cow, now all this food's available. My diet wasn't no, 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 no. It was just a little bit of that, some more of that. But yeah, that probably was just after that, when that happened. I never put that together. Back then I still was eating a lot more red meat. It was when you're traveling for work and you have the company credit card, you sit down at the restaurant, you're like, hey, give me the ribeye.
Yeah.
It's so easy. And you guys know, there it is. Ray posted it. He beat me to it. James and his ribeye. But that right there, now that I think about it, there is a connection, and eating more plant-based. And I haven't, for those of you that are thinking, oh, I can't go vegan, I can't go vegetarian. I'm not that. But what I do is my diet is majority fruit, vegetables. It's plant-based. I've worked them in, and to me now, instead of it being a side salad that I would add to my meal, now my side, and it's not every time, it may be animal-based. It may be some egg or chicken and occasionally red meat, but I really am making a big effort to limit myself to just once a month having red meat. And it's working great for me. I've gotten used to it, and I look forward to it. Like, hey, my treat's coming up. Now, what are some, and Ray's saying Dr. Pepper. Oh, all right. It's Ray loves Dr. Pepper too, I think. He's drinking some. Oh, I thought I could never give that up, but I did day one. But let's talk about what are some foods that we should either greatly limit or avoid, at least be really aware of, hey, these are things that could lead to a gout flare-up.
Well, for sure, organ meats, animal meats, specifically, I mean, really, really importantly, the red meats, but also even pork and game meats. Those are something that you really want to be careful with because of the level of purines in that animal. So really, really, James, just like you said, it's focusing on reducing the amount of animal proteins in your diet. It doesn't have to be an entire elimination. In some cases, it is really important to do that for kidney preservation. But if you are working your way towards that, even cutting down those and reducing the number of times can be so, so helpful. So right off the top, animal meats and specifically organ meats are going to be really high in purines. Seafood, shellfish, all of those kind of things also are higher. Again, it's that.
These are all like some good things.
I know, but we know, and we talked about a few weeks ago about low protein diet, things to be careful with, how animal protein is very, very high. So again, this is one of those things where it's kind of lining up to think, I need to be careful with my protein. So by cutting out those animal products, I'm going to help keep my kidney function better, and I'm going to reduce my risk of gout attacks. So it's really a win-win with this kind of stuff. Yeah. Two of the other big categories, alcohol. So specifically beer and liquor, like hard liquor, is going to be high in purines. So you want to be really, really careful with alcohol. Alcohol messes with a lot of things in the body. can have worsening blood sugars, worsening blood pressure, can also interact with medication. So, I mean, alcohol across the board, you really need to be careful with. And I do have clients that drink alcohol, not necessarily beer, liquor all the time, really. I'm really, really hesitant about that. But talk with your doctor for sure. You really want to get medical, just so they know that you're drinking alcohol, because if it's interacting with your medications, they need to be aware of that. So make sure you let your doctor know. Don't be shy, be honest about it, because the only person that is going to be suffering consequences by not telling the truth is you.
Exactly.
Right? You as the patient. So be honest and make sure you have an honest conversation with your healthcare team about that, because you're going to get better results and better support with more honesty with that. Yep. And then the last one.
The last one's the one that makes me cry. It was the hardest thing for me to give up.
It's a big blanket. So it's the sugary foods, and especially drinks, beverages that have high fructose corn syrup. Okay. So these things that are sweetened with sugar or sugar like high fructose corn syrup, you've got to be careful with. That's really, really aggravating for gout. And there's a lot of evidence to show that a high sugar diet will lead to more gout flares. So if you're having a lot of gout flares, take a look at your diet. I always talk with clients about tracking their food. We've talked about chronometer and just whatever kind of journaling you want to do. But tracking your food can give you some really, really great insight into what's going on. And if you have a gout flare, you want to look back a couple days and see, what was I up to that caused this? And it could be a few days that you have to look into to get a really solid picture. You can't just look at one meal or one food item and say, oh, that must have been it. It's really a bigger picture than that.
Yep, I would sneak. So I was driving a lot back then, traveling a lot from Cincinnati to Chicago, fighting all the toll roads and all that. And of course, you got to stop and get gas. So I would stop at all the truck stops. And of course, they have some of the best snacks, the best road snacks, which of course are not healthy. And every one of those, and I would limit myself, but I know this is part of it. I'd limit myself to just like occasionally, I hate to say this, not a Dr. Pepper, racist Dr. Pepper. That little donut case they got, just the lights and it shining and the stuff. And sugar was one of my tough things to stop. And I still fondly think back on sugar, Krispy Kreme.
Yeah. I had a client that we've been working together for about 4 months now, and she recently told me that she's totally lost her sugar craving. She says like it's not even a thing for her anymore. She is doing really, really well. She said she could live, like she would walk down the Sam's Club's aisles and see all of the big packages, and she wouldn't buy there, but she would just be kind of craving that and wanting to get it. And sometimes she would indulge. And now, after eliminating out of her diet for several months, it has to take some time. But now she's like, I don't have any cravings for it. It never pops up into my mind. And that's where the magic starts to happen, that your body is resetting into like, this is where we're at. Like, this is what feels good for me. And that's what's really exciting to witness for people.
And I would say I don't have strong cravings, but I still, if my kids cannot bring a box of donuts in the house and leave it laying around, or my neighbor works for a company that makes delicious snacks, and he's like the distributor to all the supermarkets across the country. So they always have great stuff. And I tell my kids, you cannot bring it in the house because my willpower is not strong enough. But when it's not around, I'm good avoiding the high sugar, the high fructose corn syrup snacks and treats and all that. But that's one that it took me a long time to find alternatives to address that sweet taste that I desired. And I couldn't go into like the Hostess Twinkie factory or anything like that and do a tour or go to Hershey, Pennsylvania. I just couldn't do those things. I
don't know. I mean, sometimes when you do those tours, you learn how they make it, and then you're like, oh, that's what I've been eating. So sometimes it's kind of interesting.
A Twinkie tastes too good. I don't care how they make it. All right. So that covers a lot of the foods that we should, and all of those really are foods that even on a renal diet, we should be watching. We got to watch sugar. It's not good for our blood sugar. It's not good for our kidneys. We're more likely to develop diabetes or be diabetic or pre-diabetic. So all those things, it's nothing really shocking. Now, what are some foods that are good to have with gout? And there's one of them, I'm pretty sure you're going to mention it, that became my secret gout medicine. It wasn't a medicine, something you eat that I had never snacked on these ever in my life in this form, but now I keep them in the freezer and I love them as a snack, and they helped me through my gout. So what are some things we can eat? And I'll let you know when I'm pretty sure you'll say this one because it's on every list that I ever have looked up. So what are some foods they're good for us? I
mean, one of the first things, of course, a lot of people know about are cherries, right? So
that's it. Yeah, and Tracy even said it before we got to this point. Very good, Tracy.
Okay. And I think there's, I've even heard it from some clients too, that they think there's certain kinds of cherries that they have to have when it comes to helping with gout. But there's research to show that even testing a variety of cherries, to go into that kind of detail and that kind of research is still kind of in the works, but they're looking at all these different kinds of cherries are still being beneficial to help with preventing gout attacks. So having some cherries, fresh, frozen, even a little bit of cherry juice if you want, but again, be careful with the sugar. If they're adding sugar to it, then that's on the list of things to watch out for. So I prefer, like, my favorite thing is frozen cherries in a smoothie. Like, that is so good to me. And then fresh cherries, of course, in cherry season. Yep. It is a moderate potassium kind of food. So definitely something that you can have in your diet. It's just a matter of how much, which we know everybody has different amounts that they should have. So keep that in mind. But cherries are a very specific example of something that can help. Of course, you can do vegetables. So again, the fundamentals here, plant-based. So we're looking at fruits and vegetables. Even vegetables that have purines in them are still shown to be okay to include in the diet. So it's not something that you automatically have to eliminate if you're dealing with gout. If you are really, really cautious about all the other things that we talked about of what to avoid, then maybe it is something to look into and just kind of try one at a time to see what's going on there. But don't just pull everything out of your diet and then wait to see what the result is, because the result's going to be you're hungry and angry.
Yeah.
That's the result of everything out.
Yep.
So did you want to add anything?
Oh, no, I was going to say, the cherry one, people are chatting about it. They're recommending cherries and stuff like that. That was what my doctor told me. He said, go get you some frozen cherries. Snack on those. Mix them in things. You make smoothies, throw some in there and try them. And it was shocking. I'm like, I've never had a cherry except on top of a sundae. And that's kind of sort of a cherry. You know, it's all that red color and something in there.
We're going to go back to that conversation about the factories and how you see things are made.
That's what I don't want to know, because I love those cherries that they put on the ice cream. Yeah. But that's good.
No, so we're talking about full fresh cherries or frozen cherries that don't have anything added to them.
Yep, exactly. And you showed a snack about maybe 4 weeks ago on your Facebook channel, the yogurt brittle. How you take the yogurt and you put it out there and you put stuff. So when I did that, which didn't last long because I ate too much in a day, it was delicious. I got my bag of cherries and I sliced them very slowly because I can't cut like you do. You're like a ninja on the Me, I'm very slow. And I spread those out and I made a pattern, and it was delicious, having the yogurt, the cherries, a little bit of blueberries, some strawberries, and other, fruit that was good for me. And it made a great dessert. And whenever I think, ooh, I kind of had the feeling, and I know this isn't real, but I get a feeling like, ooh, could gout be coming? I don't want to go back there again. And if I fear about it, I go to the cherries. I'm like, I'm going to eat some cherries for dessert. I'm going to snack on some occasionally this week. I don't plow down, eat a whole bowl of cherries or anything like that. I just add them to my diet, and then I'll be like, yeah, there's no meat this week. I'm not eating any animal protein because I get a feeling, and it is probably just up here, not real, that I could be on the edge of gout. And it's one of those things like I don't want to go back there. So that cherry is my rescue.
Yeah. I mean, I think it's definitely something, like you said, you don't need to eat like buckets of it.
Yeah.
Just a handful every now and then. It does not mean you have to be downing cherries every turn with every meal. So just kind
my
of
mom just posted that she put a cherry tree in the backyard. Awesome. I know where she lives. I could go get some.
So some of the other components that we talked about foods to include to prevent gout include whole grains. So whole grains have a lot of health benefits, and that's one of the things that they look at when it comes to whole grains with a gout prevention diet, is because the whole grains are reducing your risk for other cardiovascular events, with stroke, even with diabetes. We talked about the importance of fiber with blood sugar control. Including whole grains is going to be something that can be really, really helpful to prevent other complications. So whole grains are a really good go-to. We've also talked about the heart healthy oils and fats. So avocado oil, olive oil, flaxseed oil or flax seeds, make sure they're ground. Chia seeds, hemp seeds, those are all really good things to include in the diet. Even nuts and nut butters are a good thing to include in your diet. So they have seen that peanuts specifically produce a lower urate level. So the uric acid. So for whatever reason, peanut butter, again, we've talked about how you can have this kind of stuff even with kidney disease. It all depends on how much. So keep that in mind, but don't be afraid, depending on your circumstance and your situation, to look into see if that's something that could work for you. So a few others that we have include dairy products, so low fat or fat free. So dairy has been seen to have a protective factor in preventing gout attacks. So including some dairy, if it's something that works for you, is an option. Not everybody does it. Not everybody wants to do that, but it is an option. And if you have a lot of gout issues, that could be something that you could look at doing. So we talked about, instead of going completely vegan, be vegetarian possibly, and then look at some of the dairy products that are lower in protein, and that can help with balancing out some of these issues. Always be careful with added sugar or added sweeteners or whatever the case is in your dairy products though, and sodium as well.
Yep.
Let's see. So if you are to do animal meats, doing the lean proteins, the lean animal proteins, and you really want to be careful with how much you have. So the recommendation is, 4 to 6 ounces per day. And that's the size of your palm per day. Okay. So it's still a limited protein recommendation, even with the lean animal proteins.
So, and what are the lean ones? That's chicken, turkey, fish?
Chicken and fish are really, turkey would be another one. I know some people think pork, but pork is more of the high purine animal meats. So that would not be advised. So focus chicken, some fish, again, seafood was listed as high purine as well. So be careful with how much and how often you're having those kind of things, especially when it comes to gout. If you're having a lot of gout attacks, that is something to be aware of and to be very mindful of when it comes to your health and those triggers.
Yeah. And someone had asked earlier in the message about how often they could eat fish, and they were saying they eat it, I think 2 or 3 days a week they have it. So it sounds like that's probably okay. It's not an excessive amount of it to have it a few times a week, something like fish.
Yeah, I mean, it all depends on the lab. So you're going to get the best answers working with a dietitian one-on-one, who will be able to look at your labs, look at your health history, look at your medications, your food journals, look at all of that, and to say, yes, you're on the right track, you have the right balance. They might say, actually, you need more or you need less. But working one-on-one with a dietitian is really where you're going to get the most cut through answers right to exactly what you need to hear for your health. Everything else is going to be a recommendation, guideline, a general idea, because they can't look at your information in particular, which is a lot of information to look through.
Yep. What about beverages? I've heard
Yeah.
a rumor about coffee. Is that true?
So with coffee, there is some evidence that having coffee in moderation, like 1 to 2 cups a day,
Mhm.
could help lower the risk for gout. And remember, you can have coffee even if you have kidney disease. It has potassium, so it's something to consider, and it's a fluid. So it would be something to pay attention to if you have a fluid restriction, if you need to be monitoring your fluids, that's something to be aware of. But there's evidence to show that coffee can help reduce gout attacks. So 1 to 2 cups, again, going back to the added sugars, things like that,
Oh
keep in mind
yeah.
what you're putting into your coffee. If you're gonna add a lot of sugar to it, that's going to kind of offset the idea that it's preventing gout because of that extra sugar in the diet.
Yep. So probably no Starbucks caramel macchiatos the way I used to order 'em, with extra, extra, extra caramel. I always said it 3 times.
Yeah, no, I don't think that would be a very gout safe beverage.
Yeah, I would drink the coffee, and I hate the taste of coffee. I would drink and have like that much melted sugary caramel at the bottom and just guzzle it. It was not good for me. Yeah, the coffee would be helpful for gout, but that sugar is really, really bad.
Yeah.
And what about wine?
Yeah, wine is another one that, in moderation, has not been shown to increase the risk of gout attacks. So that's something that I kind of negotiate with some of my clients when we're creating their individual nutrition plan of if that would be something that they could or should include in their diet. But
Mhm.
again, in moderation. Moderation for alcohol is 1 drink per day, 5 ounce glass of wine for women, or 2 drinks per day for men. We as women, we got the short end of the stick on that one, or the short
You
stick
can
of the
have
draw.
mine. I don't drink alcohol.
I appreciate a good glass of wine. So but it's really good to know that in moderation, wine is something that could be acceptable to include and to keep in your diet.
Yeah, so beer and the harder alcohols are on the bad side, things that could cause a gout flare up. And wine, which is it's great, that's something that's on the more positive side that hey, we can have that and
Mhm.
shouldn't have to worry about a gout flare up. Very good.
Yeah.
Now, let me take a quick look at the questions right here. We've had so many that have popped up related to some of the things we've talked about. This one I really like. I do not know the answer. When it comes to sweeteners, is honey okay, or does that count as a sugar?
Honey is a sugar. So sugar, by definition, has like a million names to it,
Hmm.
and honey is one of those. I think honey can be a decent type of sugar to include in the diet. It's still something in moderation that you don't want to go crazy
Hmm.
with. But we talked about this before, that the honey, especially local honey, can help with
Yes.
reducing allergies. So I think that's really, really great. So I typically am okay with some honey in the diet if that is your chosen sweetener.
Very good. Because I'm always tempted to buy some honey. Over the
Hmm.
weekend, we were somewhere and it had local honey. And I was like, oh, it'd be great to get some of that. But I didn't. But I kind of wish I did. 'Cause I don't have any sweeteners that I use. And I kind of
Yeah.
feel that I'm missing out a little bit.
I mean, if you're not adding it, I wouldn't say it'd be anything to add in. Like it's going to provide all these kind of benefits to the
Hmm.
diet. If you're a person who already likes to, I mean, one of the a good combination ideas that comes to mind for me is like green tea with honey
Hmm.
sweetened. So
Yeah.
if it's something like that you were to do, that's fine. But I don't think inherently adding something like more sugar into the diet is going to necessarily be more beneficial. So sugar still can uh, cause some gout issues. So don't go in adding things if there's a concern about that.
Yeah.
I just want to be cautious about that. I definitely don't want
Yep.
to say, oh sure, go ahead and add that.
Now, another question we've had a few people ask, and I'd love to get your comments on. When we were talking about the cherries, first of all, that was popular. People love talking about cherries and different types of cherries. Um, is there a difference, or what is the difference between getting like the whole cherries and the dried cherries?
Well, so the dried cherries are really just dehydrated. So anytime you have a dried fruit, it is going to be significantly higher in potassium. Even a low potassium fruit, that would be low potassium fresh and whole, dehydrated condenses that potassium content. So that's the number one concern I
Mhm.
have with dried fruit, especially for cherries. I already said like cherries are a moderate potassium fruit. So if you're to take a moderate potassium fruit and condense it, it's going to become higher in potassium. So dried dried fruit in general, I'm not like super crazy about
Mhm.
because the smaller portion size.
Exactly.
Kind
It's
of, we've talked
easy.
about like
Grab a
nuts.
handful of it
Yeah.
and you don't realize, whoa, that was so much, really?
Yeah, exactly. So it just adds up way too quickly. And I mean, if you think about like grapes versus raisins,
Mhm.
eating a handful of grapes versus a handful of raisins is a very different nutrition parameters, especially when it comes to potassium and sugar as well.
Mhm.
The sugars are condensed in there. So a general serving for fruit, let me go across the board here. So
Mhm.
for fresh is a medium piece of fruit, which is about the size of your fist. For anything that's already like kind of cut up would be a half cup. Anything that is dried or more processed would be like a quarter cup. So think about those variations. So a cup of grapes or a quarter cup of raisins. That would be the equivalent.
Yep. I'd much rather have the full cup of grapes. And I love grapes compared to raisins.
Yeah.
Yeah, I used to eat a lot of the dried fruit, but my doctor told me you got to be careful. The portion sizes are so much smaller, and it's easy
Hmm.
to sit down, Netflix and chill, and all of a sudden you had the big thing of raisins and you just ate the whole thing as a snack.
Yeah.
And that's a lot of it's scary when you see how many servings are in there and you turn that thing around and it's double digits. Like, oh,
Yeah, exactly.
now, are there other? So we kind of talked about foods we should avoid, foods that are good to look at adding into our diet if we have gout issues. Are there any diet considerations outside of those for gout and kidney disease? And we kind of hinted at some of those or touched on them in the beginning, but could we kind of summarize those for everyone?
Yeah. So one of the things, some of these like last recommendations I would have would be to make sure you're hydrating. So think
Mhm.
again about what's going on with the body. Uric acid is collecting in the body. So make sure that you're staying really, really well hydrated. If you're not on a fluid restriction, if your doctor or dietitian haven't directly told you to limit your fluids, you should be really focused on drinking a lot of water. Some people are drinking upwards of 16 cups a day to prevent high uric acid from collecting in the blood. So stay really hydrated. Number one is drinking water. There is some evidence that vitamin C is shown to be helpful with preventing gout flares, but as we've talked about before, supplements, vitamin supplements in particular, you really got to be careful if you have kidney issues because the kidneys in this case are responsible for getting rid of extra vitamin C. So you don't want to take a supplement that has like 8,000% vitamin C. And then if you have a less kidney function that can't get rid of it, you're kind of playing whack-a-mole in that sense.
Mhm.
So be really careful. Don't start supplements, even in this case, without first talking with your doctor or dietitian about it. What you could do instead to pair along with the idea of hydrating is just add lemon water. You know, just use some lemon and squeeze it into your water to give it some flavor. And lemon is a great source of vitamin C. So you're going to be giving yourself a good amount of vitamin C just by doing that and by staying hydrated as well with drinking more water.
Yeah, very, very good. And that lemon, that was one of the tips my doctor gave me. Start adding lemon to your water because I had some kidney stone issues. Luckily, not that bad. And I believe mine were calcium
Yeah.
was forming my kidney stones. He said add lemon. So now, whenever I drink, I can't show you guys in here; it'll all fall out. But my water always has lemon in it. Usually like some dehydrated raspberries or something like that, also to give it some flavor. And I have not had a kidney stone. Knock on fake wood. Since I started doing all that. I'm also eating a lot better in my diet and staying very well hydrated, like you said, so that things can keep moving and hopefully get their way out of here. without kind of collecting here in my body. Now we are almost at the top of the hour, so I'm going to scroll through and see if there's any questions that were asked that we didn't touch on during our conversation here. There was so much great stuff. And I'll tell you, people love the cherry. We got to do some cherry recipes. You do them on your Facebook. Yeah. I would love to see.
I've posted them before.
I would love to see, and I have not looked for this, like a low sugar cherry pie. Oh my goodness. I loved those little ones.
Maybe instead of a cherry pie per se, what about like a cherry crumble where you would have like the oats that baked on top?
Yep. You know what?
You could do something like
Here's
that.
What's funny. I've seen those before. I want to say on movies or something. But I think I was such a bad dieter, or my diet was so bad that I just overlooked anything that even had the remote look of being low sugar, slightly remotely healthy. I think my eyes just blurred it all out and blacked it out.
I've definitely heard this before from people, from clients who say like fruits and vegetables are a totally new thing to them. So it's tough. It can be really tough making these kind of changes into the diet. But
Yep.
I mean, thankfully, that's why I exist, is to help out with that and to give ideas and recipes and share some things to help you get inspired to make more fruits and vegetables that are healthy and that you enjoy and that, you will have your family enjoy. I had another client who was telling me that they are doing phenomenal with a plant-based diet and teaching their kids that this is the way we eat. And I'm just thinking,
awesome.
Oh my gosh, how wonderful is it that you are eating healthy, not only for yourself, but you're teaching your children, like, this is the normal. And I mean, that was something for me personally. When I grew up, my parents, we always had fruits and vegetables. Like you have a vegetable with your meal. That is a guarantee. And that was something I took even after I moved out and was doing my own thing. To this day, it's still, where's the vegetable? Like, I need to have vegetables on my plate. And whatever you're teaching your kids or your grandkids, they are going to take that with them because you are showing them this is normal. This is the way we eat, and this is healthy and good for us. And they're going to really appreciate that.
Yep. And let's see, we have someone had asked, and this was a great question. How long will the pain of gout exist? So mine lasted for days. Swollen, red. My toe, not the toe itself, but my knuckle of my toe.
Yeah.
Looked like I had a bee sting. Right? It was swelling. And it may have just been me, but when I touched it, it felt very warm. And I didn't want to touch it, and you didn't want to bend your toe. It made it very uncomfortable just wearing my shoes. And luckily when I come home, we had the habit of taking our shoes off and putting on some sandals. And that would be comfortable. But oh my goodness, there's a few times when I was traveling and it would flare up. But do you know about how long it typically lasts on average?
I really can't say. I've heard it going from, a day to several days beyond. It's really individualized for everybody. I think that's a really good question to ask a doctor who's seen more situations like that come up. I mean, again, remember we first talked about how to find out if you have gout. You have to go see the doctor. So doctors are already assessing, they'll say, how long has this been going on for? So they have a lot of experience in seeing what's going on for people, and they can give a really good range.
Yep. And here is a great question. I can't believe I did not ask this. Awesome question here. Oh, oops, I clicked the wrong button. Here we go. Where can you get gout besides your big toe?
It can occur anywhere in your joints with your bones. So it's arthritis. Yeah. It's a type of inflammatory arthritis. So think of all of your joints. Okay. The most common is the big toe. That's the most common by far, but it can happen anywhere around your joints. So your hip, your back.
I would get it here too. And what was weird is I didn't get it evenly on both sides. now that I think it was always worse on my right side. And I don't know if that's just maybe something to do with circulation or something. But yeah, my big toe first, that joint, and here where I would see the red swelling. I would get like some pain, or I would feel like I could feel it in my fingers, and maybe it was just starting to form the crystals there. But I never had any swelling there. But yeah, it's not just your big toe. Yeah. Oh, and someone said their gout lasted for 8 days. Wow, I haven't had it that long.
Oh,
Wow, mine are probably 5 or 6 days thinking about it. I leave here on Sunday, come back on Friday night, and usually about Saturday. So yeah, wow. Oh, and I'd be standing up doing all day training sessions, walking around these big rooms with the toe just killing. I tried all the inserts. I'm like, it's got to be an insert. There's something I got to be able to do. Of course, I'm avoiding ibuprofen and anti-inflammatory.
Right.
Yeah, and someone else says their knee flares up. It's been going on 10 days now. Ooh. All right. So we are at the very top of our hour. Woohoo! Wow, we have covered all sorts of great information. None of other people are talking about their gout. They're not enjoying gout. They like our topic.
No.
They're talking about, they're like, oh, they're saying it was horrible. So if you are at risk of a gout flare-up, definitely look at your diet. Talk to your doctor. If you've got a dietitian or a renal dietitian, talk to them. There are things you can do, like we talked about today, to greatly reduce the potential of having a gout attack. And I never even knew they were called gout attacks until it happened to me. And my doctor's like, yeah, they're called a gout attack. I'm like, well, that sounds kind of bad. And I thought, well, it hurts a lot. It is bad. That's the right name for it, gout attack.
Yeah.
Yeah. So I want to thank everyone. If you have not subscribed, please go to YouTube, click the subscribe button, share this video if you can, give it a thumbs up. We want to get the word out to more kidney warriors out there that there's all this great information to help you live a better life, to improve your quality of life and live with chronic kidney disease. It does not have to, put your life on hold and slam on the brakes. I'm living great. I still have those awful bad kidneys that I had when I spent a week in the ICU. They're not better. There's no fixing that damage. It's still there, but I'm living healthier. I'm taking care of myself, and my kidneys are kind of rewarding me by saying, hey, by not overburdening us and living a better life and eating better, we could do a bit more, even though we're still damaged. So please, consider your diet and stuff like that. And let's share this information, get it out there. All right, everybody. Thank you so much for joining us today. Jen and I will be back next Tuesday. I've also updated the schedule of all the future shows for this month. I got one more update to make that Jen and I just talked about before we started this one, but I updated it. We have Dr. Butt back next Wednesday and every other Wednesday after that, and another nephrologist joining us on the 23rd to talk about some really cool stuff. I'll be posting more information about that coming up really soon. All right, Jen, thank you so much for your time here. Everyone here really appreciates it and your knowledge. And if they're out there and they haven't joined your Plant Powered Kidneys Facebook, I hope they go and they join right after this. All right, thank you, everybody. We will see you next week. Bye.
Bye.